Hello, dear Professor Gert Kwakkel. Welcome to the 8th European Congress of Neurorehabilitation. The ECNR brings together the scientific and clinical communities. What do you believe is the unique role it plays in bridging the gap between research and daily patient care in neurorehabilitation?
I think they are important just to invite people who investigated important research, and I think the role is to communicate with each other more between the different countries within Europe. And I think that it's important that the European society is collaborating with other societies, because in Australia, Canada, in the United States, they have the same problems as we. And they have also societies, so let's bridge by moderating activities of this European federation, just to make connections with the other worldwide initiatives to improve rehab.
And considering your specialty, what future developments do you envision for the complex multidisciplinary field of neurorehabilitation?
Yeah, it's a tough question, because from my discipline, I started in the 80s, as a physical therapist, and subsequently did my movement sciences, got my PhD, and now professor in this field. But yes, I'm solving a little piece of the big puzzle. And I think that the next step is that we should collaborate, because in the field of neuroimaging, for example, there's some very big breakthroughs. We know about the thrombectomy and thrombolysis and other achievements that we have in order to understand also what makes stroke recovery, for example. And this is different from multiple sclerosis or Parkinson's disease. So there are too many pieces and diagnoses. And so as a movement scientist, and to understand, for example, motor plasticity, then make movement sciences connected with neurosciences. And if you make this connection, you will get better understanding what these macroscopic changes in fMRI or EEG really represents.
And is there a specific trend or technology that you are most excited about from the field?
Oh, there's no, because we are struggling with using technology. Technology is interesting, and you have to distinguish between the therapeutic technology, thinking about robotics or other things that you can do in order to improve behavior or cognitive impairments. But on the other side, there's also a monitoring side. And I think the most and biggest achievements have been gained on the monitoring side. We now are better to measure quality of movement, for example, and what patients also are doing outside the laboratory. And having also gait labs, etc., that's the biggest achievement till so far. Not the robotics, not the TDCS or these kind of stuff. And we think that we can help the patients because the evidence is very weak.
And from your perspective, what is the most challenging future development in neurorehabilitation, and how can the ECNR come closer to this endeavor?
Yeah, if you like, for development of stroke rehabilitation, for example, what my focus in particular is you need to understand better the pathology and why is this patient recovering and the other patient not. And if you don't understand these heterogeneity in recovery patterns, how patients are improving by time, and some patients don't improve and some patients will improve within a couple of days or weeks after stroke, it's hard to do interventions and trying to understand what is my intervention doing on top of this recovery patterns. So the first low-hanging fruit, what I say, is start with understanding better why are patients recovering or not within stroke. And for this purpose, you need to collaborate with the acute neurologist working, knowing that stroke is defined in the first 24 hours after stroke. And we know this by thrombectomy and having good collaterals in your brain and making some patients that even after thrombectomy can walk again and go home. So to understand why patients are recovering months and even years after them and how rehab is interacting with this process, you need to collaborate again with the acute neurologist as well as all these disciplines after discharge from the stroke unit.
What do you see as the most significant barrier preventing our understanding of neuroplasticity from being effectively translated into reliable therapies, and how can we overcome that?
Yeah, the brain is very plastic and we know that, but the interpretation is another thing. So we can see that the brain is adapting with new networks in EEG, showing coherence in muscular skeletal and EEG coherence, for example, in high density EEG. And we can follow these patients in the repeated measurements and seeing, okay, what does these plastic changes in fact mean? We know there's a motor learning, plastic changes, but there are all plastic changes that are independent of motor learning. And to understand these plastic changes, you know exactly to know what is learned and how are patients changing on the outside. And therefore, I think there's an opportunity to connect, for example, if you like to stand motor recovery, to connect movement science with neuroscience and these plastic changes in order to have an idea what does it mean, these plastic changes in the brain that's happening.
All right. Thank you for the interview and thank you for being here.
Thanks for the invitation.